uh, business goes on. And that's exactly what our next speaker, Mr. Ramachandran, Director, Global Field Delivery from HPE Point Next Services is going to be talking about. Business continuity is the key. He has more than 25 years of IT experience, most of it across India, combined with a stint at Singapore, leading APJ sales for cloud business. 20 years of successful stint at HPE, an old hand. Held various leadership positions across IT, product management, sales, consulting, and currently as overall services delivery leader for India geography. In his current role, he is instrumental in transforming the delivery with laser sharp focus on enhanced customer experience. Business continuity is the key. Ram. Please unmute yourself. Yes, go ahead, please.
What a great morning to be here. And thank you for having us here. Absolutely, the platform was set by Dr. Gunjan, and voice of the man or voice for the man came from Samir, and voice for the system came from Professor Prajapati. What an excellent fortune that I have to share the platform with all of you, the contributors to the new transforming journey of India. Absolutely thrilled to hear from you on all of this context that can put the best of ideas to the common man and that can help them. What I would do in the next maybe 10 minutes is to just see some pointers that I took from Dr. Prajapati on how ideas can be turned into reality, right? What can we do together as private and public in terms of delivering those that can make a difference to a common man's life, right? Let me attempt that. First of all, wish each one of you on this call and otherwise a safe and secured time ahead. Let me thank Dr. Sabir, Dr. Gunjan, and the SKOCH team for giving Hewlett Packard Enterprise an opportunity to share on the areas of work that we have done, especially during the pandemic. And I'm appalled by the way that you've taken notice of the work that we have done. Thank you very much for that. So let me take that first slide here. What you see here is primarily the people who had made differences to us. On the from Prime Minister downwards to the ministers and the government officials on the policy making, and the people on the ground who actually made our living as normal as possible, the medicos, the police, the health workers, the pop and mom shops that fed us on this pandemic, in this whole system. And also thank the HPE folks who are supporting all these customers, the essential services customers and beyond, being on-site and remote. What I will do is I'll just give you the first few minutes about what HPE has done as business continuity plan within the organization. As a global organization, we got a whiff of it a little early. So for us, March 4th was the day when we had the first BCP mock conducted across many geographies in the world. And that happened in India too. That means 10 days ahead of WHO announcing this as a pandemic. So what did we do in this? If you look at, we have 4 large entities adding up to around 20,000 people, both direct and indirect. We had people working for India business. We had people working for engineering and research. We had people working for global operations, and we have people working for global functions, which are running or which are directly involved in publishing our results. Most of these functions happen out of, most of its activities happen out of India. If you look at, if something happens to our offices and we are not able to function, look at the impact that we will have it at the global level, the functions that India delivers for the global activities. So what have we done? We have created a complete BCP plan. We had a mock done on March 4th, where we had 99% of employees completely working from remote, which means that we had ensured that they had the required connectivity. They had power backup in certain of the locations where it was much needed. And with this functionals, we tested completely, and we had the first quarter end, that our quarter end Q1 ended in January. We had the financial results published for India and global seamlessly working remote. We had the CMT team, we call it the contingency management team. We work at multiple level from the districts to the country to the global. That's how the hierarchy is. We work with every level to ensure that every employee's safety is clearly the utmost important for us. We devised a protocol in terms of what they need to do in case of emergency. We had these virtual teams comprising of business, finance, HR, IT, all of them together to ensure that they have a seamless experience, both with their personal safety as well as delivering on the services that we are expected to support the government and other essential services. So this whole activity happened, and even now we are completely remote. If we have to go to office, we need to have a separate application, a mobile app, where people have to request. This is the essential activity that they need to do, and the approval is given, taken at the L2 level. Otherwise, people are not allowed to get into the office. While there is a policy that says that we can operate from 33, but we just wanted to check how much of it we could extend completely remote, so that if in case this continues for a longer period, we have the plan and we have the activities and actions in place that helps us run through the year end, which means we are going to have this month end, the second quarter closing for India and global, going to be supported completely remote, and it is going through successfully and seamlessly in all these times, right? That's the kind of BCP that we have put in place. What is that we divided? We divided the activity into physical, which are people. Where are they going to be? Many of these people, we have different generation of people in this organization. We have the Gen Z who are working on shared places in today's world. So how do we get them together to work in enclosures that can help us to be safe, secure, and also maintain the confidentiality that are to be maintained for the organization? We put that as physical as first activity. Second is IT. What support we need to provide them, what kind of VPN access we need to provide, what kind of minimal bandwidth we need by the tool that they are going to operate. What are the automations that we're going to bring in so that the calls that are landing in the office automatically gets redirected to those respective individuals? And how are we going to make their efficiency improve or maintain? For them, if they are in office, they have 20 other avenues of getting those informations. And look at, you confined to your desk with limited such available resources. What do you do? So this is where we put together the whole plan, and we worked on each of those functions. Today, we have completely completed second quarter, and I'm sure even if this has to continue for a financial year-end closure, working remotely, I don't think there are any challenges. People have come absolutely working on the new norm. They understood what needs to be done, and it is working in our favor, right? So this is the business continuity part that we have maintained within HP. We are now 99.999% completely servicing our customers. Just to give you a frame of it, we handle around 120,000 cases as support calls, one function of what we do in the country for a year time. That's only for India. If this team is supporting global functions for most of the English-speaking countries, you can multiply the volume that they're handling. And we are currently maintaining our TCE at roughly around 96.7% globally. If you have to achieve this seamlessly, you could understand what needs to be done at the back end to provide this experience to our customers. That's a kind of enablement that we have done. And it is so far with all the support. And it is important to mention, the customers are understanding the reality, they're supporting, and wherever they could handle some of those flexibilities required, they're absolutely forthcoming and handling this. This is the first part of the discussion. I'm moving into the second part. HP has been supporting India in the transformation journey for smart cities. We have around 10 of smart cities. This is the typical blueprint that used to be there before the pandemic. What is that we need to do if you have to make a city smarter? It's primarily providing a consolidated environment where you have all the critical components that we need to bring in the smartness, whether it is public transport in terms of routes, in terms of the capacity management, revenue increase, or it is about traffic management, or creating a green lane, or it could be fire, any department, what I mentioned here. These were the critical discussions that used to happen before the pandemic. But what good thing happened because of smart cities? all of these varied departments within a state are now interconnected, which means their applications are all connected in one form or the other. There is a data exchange platform that is created, and in one location, we are able to do all of this. When pandemic was announced and India trying to cope up, in every state, they wanted to create one center, a nerve center, and they were looking at what should be the right place where we could create this platform where our chief ministers, our secretaries, our collectors, all the government officials can operate from one location and they can have a bird's eye view of what the city is going through. They didn't have a better place than that of the smart city and the nerve centers and the war rooms and the situation rooms that were created for handling these emergencies. So what happened when the pandemic announced? There was these discussions that happened between HPE, people like HPE who are supporting every state and the government officials, and how do we get this, the fastest way to get those information highway created by which we can collect data from different departments, make sense out of the data, send those data back to those important people who are on the ground with the correct information, ensure that the right actions are taken, and the feedback is given back into the system so that we track till the closure of what happens with that particular event. Now, for example, what used to happen, first of all, the biggest challenge that we had was, how do we control spread, right? All of us were trying to do it at the city level. Then we realized that putting a lockdown on the city is going to paralyze the economy. We need to have some relaxation. We need to really be specific on which ward, where do we need to actually take action upon. And if you look at, we need to have a clear sequence of events that has to be chained together. How do I link these events together? Third important thing, if you look at, is what are the critical departments that are involved? What are the current lack of control or information that they have, which can help them to act even more proactively? And how do we connect the labs, the hospitals and health workers, police, everybody together? So we came up with an application to handle this within 7 days, right? We understood the situation, we added the capacity. In 7 days, we had the application by which we can carry out the first form of who the patient is and use the same data to be taken into the lab, taken into the hospital, taken into the quarantine, whether home or institutional, see how the health is progressing, and then get them discharged. And even when they go back to home, how do we ensure that they get the right inputs going through, right? This is the sequence of activities that we did. How did we achieve? We use the facilities that are there, audio conferencing, video conferencing. We change this as the telemedicine center. People call up on WhatsApp video. They get into what needs to be done. We tagged people by the geolocation and made them say that you are in hospital quarantine, you are supposed to be within this. If there are people trying to step out, then automatically the police gets alerted. So we created some solution by which we control the spread. We created a chain of activities. So today, if you look at that state, which went on a steady incremental in the early days, today, if you see them, it is absolutely under control, right? How is that we have done it? We clearly had solution for every part of the problem that we identified are critical. Whether you see here, which is primarily talking about how the operations happen, people from different departments, if you look at here, they're all coming together in sharing the data points that they have. And with that data that is clearly getting back into the operators here, they get that included into the management tool that you see here, which is a dashboard that runs on direct basis. And from there, we have some functionalities that we added by including the private cameras and all the surveillance cameras. This is how a meeting was happening of the resellers in a majority a market street. They all wanted to open, but the government officials had given them guidance on what are the steps and how we're going to open it. The social distancing is monitored, the count is taken here, and the feedbacks to these teams are given on instantaneous basis. How are we trying to prevent it? That is even more important. If you look at here, we realize that there are two problems that we have. One, people impacted, and second, the people who have got into this contact tracing with contact with the people. So the contact tracing was very, very important for us. What we did here is we went by the wards of people who got impacted, and then we plotted the contacts of first and the second contact on where the residential addresses and which wards are, so that we know, one, people who are on the wards where the thresholds are, we can put the containments there. Second, even before anything can happen, We can go to the first and second contact to the respective wards and stop them moving out, being in quarantine so that we can control the spread. We gave this heads up. We gave that complete forecasting to the government on daily basis, which says that these are the wards where they're exceeding the thresholds. These are the wards where the contact is getting multiplied, and we need to create a clear hotspot called out there, and we need to take the measures there. So we had a clear 6-stage process. What you see in the dashboard is this: the whole state, the whole city, and by this you can see that the green and the amber and the red dots there, that tells you the locations and the wards within the geography how it's been done. So it's a comprehensive solution that was created by which we are able to control the spread. And today, I think the effect of it is very well seen in the results that are there when in terms of the count of people that got reduced. I'm moving on to the last part of my presentation, which is basically the work that we have done together. How does a public and private come together, and how can we solve large set of problems? If you look at HP had the e-health centers across the country. We started in partnership with CASR, with IGIB. Dr. Anurag Agrawal was a key instrumental in terms of this venture. What we created is we created a concept that we need to address the healthcare problems that we see in remote locations. So we can't construct a building. So what we did is we created a 20-foot container. We reuse those containers in terms of creating a complete health center inside that. What did we do here? We created all the medical equipments, which are connected devices. We created the complete EMR on the cloud, and we had the patients which are kept in the remote portions of the villages where people don't have access to hospitals. They can come, they visit, and they're able to get a similar medical support that we typically get in the larger locations. How did we do? We had on-site staff, we had remote partnerships with hospitals, and then we had specialists who were on the video call who supported this. So we created 130 of this across the country, and we have almost 10 lakh patients who have visited these centers. Similar to the normal day, it was meant for any flu or any problem that the patient had. But when COVID happened, we worked with IGIB and we created a COVID test lab. We knew the problem that we were not getting adequate test kits, and we didn't have places where people can walk in. And even if the problem is there in the remote village, they have to walk through and expose themselves before they reach a hospital where the test can be done. So what have we done now? We have converted few of these health centers as COVID-19 testing centers, which we collaborated with the Ministry of Science and Technology. We collaborated with the state health departments. We use the same lab, but we added few more elements to it. We added few nursing stations, which are completely isolated. We created a negative air pressure doors so that there is no spread for people who are queuing outside and people inside. We do currently around 100 tests in one such e-health center. Complete devices are connected. And if there is anything that is required for doctor on a call, that's also available from the same center. So what have we achieved now? In the last 90 days, we were able to test around 51,000 people, and we've been able to publish the results. We have currently deployed this across 4 states, and now we have almost every state that is covered in the country with e-health centers. We are now gradually progressing to ensure that this is done across most of the e-health centers that are identified, so that people who have elementary symptoms can walk into the center as close as where they live and get a similar test and treatment that typically is done in larger cities. So this is a big transformation that we worked on. This is absolutely not possible with one private organization. We wanted the complete support and the concept to be worked together. This is a great classic example of how we worked with the CSIR lab, got this whole thing done, and we've been able to spread this across the country. And our endeavor is to see how much more we can do in this and how much more we could do in terms of handling such emergencies that can come across the country. Right? At the end, I think it's important that we play a role in terms of converting the idea into a reality that can make a difference to a common man. Here are a few of the comments that we heard from people who had used our e-health centers and who felt good about what we are able to achieve for them. So this is what I had to share with all of you on the 3 topics. Hope I was able to convey what was expected. Thank you, and wishing you all once again to be safe and be secure.
Well
Over
done.
to you, Dr. Gunjan.
Thank you very much. I mean, this was quite informative. Uh, Indeed, under all circumstances, with or without COVID, the show must go on. And as you rightly said, that in order to maintain the business continuity, there are several factors that come into play. The most important being to create, under such circumstances, a common chain of command and control. This is perhaps, something which I'm sure in your experience has come out shining through. I know most of these projects, which is what you have done for the smart cities. This is all under a PPP and the smart city program, and the solutions that you have implemented. What in your experience has been the disparate challenges where you moved from geography to geography and city to city, because your experience pre-pandemic would have been different than during pandemic.
True. I think it's absolutely correct. When we were on a free flow in terms of the activities, and it was bubbling across, enabling the cities, enabling the departments, and making them more progressive and more efficient, bringing in the transparency. This is the full flow that we were doing before the pandemic. Come one day, we had been asked by the respective states or cities to say that, listen, guys, now you will have to go slow. We are going to be under containment. We are going to be under lockdown, and the whole activity has to be divided into remote and on-site. What are those that we could do together in terms of achieving this? While we do so, we don't want these set of people to be removed from the project. We will help support you guys to have them housed in our cities and states, but we want them to completely rework their priorities and start looking at how do we manage COVID from the same smart city in the same length and breadth that we're thinking for other departments. So this whole transformation discussion happened in few days, right, with each of the cities. And we need to regroup ourselves. It is a lot of selfless of, movement from our people in terms of staying back to deliver on this. We went back, and some one of the location was majorly impacted. The building by itself was impacted. So we have to make a makeshift office, get all of these people there, ensure that these people develop the tools, go to the respective hospitals, the labs, train those people on those things so that they can quickly start adapting to it, and ensure that we deliver on how do we control the spread, right? So this is how we changed. Maybe a course of 10 days or 12 days, we had to regroup, rechristen, and get all of those things delivered to manage this pandemic, Dr. Gurcharan.
So what you mean to say is that, the things have moved. So in your experience, has your engagement with the governments, your experience has improved dramatically over last 3 months in comparison to the past?
Absolutely. How do you need to be agile and more flexible in terms of using the platform and delivering to them at the speed that was required? This was unheard of, right? We typically start doing the planning activities, 3 months of study and come back and all. Here we were talking about days and maximum weeks of delivering services to the citizens. The mobile apps has to be ready. People have to have a platform to communicate with the government. Over and above the telephone calls, WhatsApp was integrated. Social networking was integrated. Sentiment analysis was diagnosed. We went back to the government saying, these are the areas. No food, no shelter for so much percentage of people who are there, and they don't know where to go. Right? A lot of these inputs went back into the government, and the way that the government worked on it and solved one by one, creating people, the systems and processes on how do they reach out, how do they disperse, how do they ensure that it went and reached the last mile, and how do we get that completely tracked. It was a different experience in wholesome when I look at what we used to and what happened in this with this pandemic.
Excellent. Well, thank you very much. I mean, with the hope that the momentum continues, and this will bring back the speedy recovery to the economy. With that hope, we move on to the next one and say thanks to Ram for giving this interesting presentation.